Have you secured your spot for the premier event for medical surgical nurses?
The 2026 AMSN convention is giving you a refreshing desert backdrop in Palm Springs, California, from September 24th through 26th. Join us and experience 3 days of unmatched and forward-thinking learning, networking, and impactful conversations with medical surgical peers who understand your day-to-day challenges.
By attending this year's convention, you'll earn up to 19 contact hours to maintain your credentials and ensure you stay at the forefront of the nursing field and medical surgical specialty.
Register now at amsn.org/events/AMSN-convention, and we'll see you under the Palm Springs sun.
On this episode of Med-Surg Moments,
LPNs never eat. Do y'all know what EAT stand for?
Celebrated my son's birthday. He invited me to an outside concert.
As far as wedding planning, we started doing dance lessons, which has been really
I've got almost 400 hours of PTO, vacation time. Our topic today is how to care for bariatric patients, which is part of the AMSN core curriculum.
600-pound male, and the hospital, I think, only had 2 of these beds for the entire facility.
There was an agency nurse taking care of a bariatric patient. The patient was eating and started aspirating.
Because you have the tools, doesn't mean you have the knowledge.
Do you guys have particular units that specialize in your bariatric patients?
I used a team approach, and that has been helping me. So if I know I'm going to get a bariatric,
I feel like every episode I learned something from Kellye because I think it was...
How do we ensure that we're promoting their dignity and treating?
What do you guys think bariatric patients in general would like for med-surg nurses to know about them?
one guy, he just really wanted us to understand that for him,
This is Marcela,
Eric?
Trish.
Kellye,
Sydney.
and Haley. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is how to care for bariatric patients. But before we get started, let's begin with some personal updates. Kellye, what's new?
my baby girl, she turned 9. So we enjoyed an amazing 3-day getaway to Great Wolf Lodge. And so for me and my family, we absolutely loved it. We haven't been there since maybe 4 years ago. We took the kids, but this time we went to the one in LaGrange, Georgia. So me and my husband, I think we enjoyed that more than the kids. It just was so nice to just relax and kind of get the summer started for them because we plan to also go to the beach, maybe do a cruise this summer. So just some time to relax and celebrate my baby girl turning 9. Professionally, I'm here to tell y'all my clinical group has been going great the past semester. And so I was selected to do the summer school this year. So I didn't mind because with this summer group that I have coming up, they will be LPN to RN bridge students. So I'm really excited for this experience, just building that foundation with students that had LPN experience. And it's not them being new nurses. This time is going to be them coming with some type of foundation. So I'm just building on that critical thinking, on that delegating, on that leadership for them. So I can kind of dig deeper into the why. Because for me, I can relate strongly to these students because I was a bridge student as well. I always remember LPNs never eat. Do y'all know what EAT stand for? So LPNs, we don't eat. The E was evaluate, the A was assess, and the T was to teach. So now them coming into the RN world, they're able to eat.
Kellye, I thought you literally meant eat. I was like, nurses don't either, so that's not new. What are you talking about?
I know, right? They don't eat. And that's basically the things that they can't do as an LPN, and it kind of separates them from being a RN.
Oh, that's such a smart way to remember it. I like that.
Thanks. Trish, what about you?
We have had super busy times at the hospital. I know that's such news for everybody, so different than you all, but we've continued to be super busy. Celebrated my son's birthday, the pharmacist. He turned 38, y'all. I'm getting older because he's getting older, but we had a great time. He invited me to an outside concert with him. He says some band that I didn't know, but we had a great time. We hung out, and it was great to hang out with he and his wife. And it was really hot. It topped 100 here today, so it was hot that night too, but it was a great time. And here, I think I told you we were doing the doctoral summit with the North Carolina Nurses Association, and that was super successful. And just planning some other events, mentoring some doctoral students, and that's fun. I've got about 3 different ones, and that's always fun to do. And that's kind of an update. No baseball games. Stuart asked me that earlier. Haven't done any baseball games yet. We got to take some in. Granddaughter's growing, and that's kind of super fun to see. Sydney, what's going on with you?
Wow, Trish, you're just busier than ever. I feel the same way. The work has been a lot lately, I'll put it that way. But lots of process improvement type things. We're really trying to push to hire some people into positions that have been gapped for a while. I got a semi-renovation project approved. So we're turning a sort of what's been used as just a storage area in one of my clinics into a patient room. So we're getting some countertops pulled out and new floors installed and stuff. So we'll go from 2 to 3 rooms, which is going to be really exciting and help our patient flow process. It's much bigger than one of the rooms we're using now. As my passion project, there's one thing I do while I'm at my current job. It's doing all this renovation project. So really excited that that's going to start pushing forward. As far as wedding planning, it's going really well. We sent out invites and published the registry. So we've had some Amazon boxes coming in, and really exciting. We started doing dance lessons, which has been really fun. We did an intro to ballroom, and then we have about 6 private lessons, and then we can go to as many group classes as we want as part of the program that this place does. So it'll be really exciting. It's going to be a fun way to dedicate like a day a week together, learn a new skill, and not look like awkward middle schoolers doing our first dance come our wedding day. So that's really the big things going on with me. I'll keep you guys updated when I'm auditioning for Dancing with the Stars, the podcast stars.
I'm excited to see your first dance. We can live stream it.
Yeah, I'll definitely get you guys the video.
Please do. Thank you.
Haley, what's new with you?
Excited to report back that right prior to hopping on to record this podcast for the day, my little one pooped in the potty. So we're moving in the right direction. He's getting the hang of it. He's such a sweet potato. He's really handling it very well. And luckily just in time, because I have my C-section scheduled at the end of this month. So nobody's counting, but 25 days. An end is in sight, which is perfect because it's 1,000,000 degrees outside and I'm dripping even sitting here doing nothing. Sitting in a chair, I'm dripping sweat with the fan on. Work-wise, I'm slowly weaning off of projects. I know last time I talked about how we're hiring a bunch of new CNSs. I feel a little less bad because I realized that I forgot how long the credentialing process is, because in Delaware, CNSs can prescribe, they can diagnose. So they had to go through the whole medical dental staff credentialing process, which takes at least 3 months. So I don't have to worry about having people hang dry because I'm not there to orient them, because they're not going to be able to start until at least October. So little blessings. Eric, what's been going on with you?
Work-wise, it's been so slow over here. It's been really low census, so I have been taking a lot of time off because I've got almost 400 hours of PTO or vacation time. So I'm kind of at my cap right now. So I thought I'm just going to take some time off and enjoy it. It's been beautiful weather, but it kind of bleeds into my personal time, which is really just enjoying being home, working on my school still. I've got one more class and that's going well. And really just keeping with the flow. Really nothing too exciting. I'm saving all my good stuff for the convention. So we'll see what happens with that. But now that we're all caught up, why don't we move on to our topic? An important topic, which is part of the AMSN core curriculum, how to care for bariatric patients. caring for bariatric patients involves much more than number on a scale. As Med-Surg nurses, we know these patients often have complex medical needs, unique mobility challenges, specialized equipment requirements, and an increased risk for complications that can impact nearly every aspect of their care. At the same time, many patients with obesity have experienced stigma or bias in the healthcare settings. The words we choose, the way we approach care, and our ability to provide dignified, patient-centered support can have a major impact on their experience and outcomes. Who would like to get the conversation started?
One of the things you just said made me think of this story was about having like dignified and respect care, because a lot of times these patients need special equipment, and sometimes the hospitals aren't the most equipped to have that equipment. There was one time that I was working and we had a bariatric patient. It was like 600-pound male, and we had him in the bariatric bed. One of the side rails was broken. The hospital, I think, only had 2 of these beds for the entire facility. We had to essentially wait for this other person to be discharged for him to get the not broken bed. And the solution was to push it up against the wall. It was not right. It was not good for him to be just pushed literally into a corner of the room because of a lack of equipment to adequately take care of him. Making sure that we have specialized equipment and that everything that we need to give care with dignity for these patients is really important.
That's a good one, Sydney, because as you were talking as well, being that your patient, well, that situation in your hospital, having to compensate using the wall, that's very, very sad. It saddens us, but at the same time, we as nurses, we have to come up with things to do to help keep our patients safe. So in that instant, I would like to just hone in on when your facility does have equipment needed for bariatric patients, making sure the staff is well equipped to know how to use and utilize the resources that we do have. We had a situation on the other end where there was an agency nurse taking care of a bariatric patient. The patient was eating, and of course the patient was eating and started aspirating. She did not know where the remote to raise the bed up, raise the head of the bed up. She did not know where to find it. She did not know where to look for it. It was hanging on the side rail, but she literally didn't know where it was. She didn't know how to use the features. It was just a really bad situation, and people had to run in to help her understand how to operate and work the bed. Long story short, we had to give her a minute in service, and we did not realize that she did not know how to operate that bed. So that was something that I really try to emphasize when I have my newer nurses and my student nurses to just say, hey, let's make sure you know how to operate the bed. Let's make sure you know how to utilize the resources around you. And if you do not know, please ask someone, and please make sure you orient yourself before taking on that patient load.
That's such a good point, Kellye, because you have the tools doesn't mean you have the knowledge. We have pretty good selection and supply at our facility, and we have stuff brought in. But if you, and there are plenty of staff that don't know how to operate it, you're just stuck with it, you know? So it's a very good point. Safety-wise also, same thing like with patient movers, like Hoyer lifts, proper body mechanics to make sure you stay safe, to keep the patient safe, all of that.
Do you guys have particular units that specialize in your bariatric patients, or that you try to focus your bariatric patients toward, or do they end up in different places throughout the facility?
I don't think I've worked somewhere that's had a bariatrics unit.
Really?
Yeah.
Yeah, we have a bariatric surgical unit where it's
surgical
patients
unit
that are coming in for like sleeves, and there's a whole
Well, they do
bunch
try
of
to
options.
focus the majority of their care there because they are the experts in their care. So the majority of the time, then they do try to refocus their care. We did a bed reconciliation the other day to try to get a look at not only our beds, because we just gotten a bunch new beds. So then it was a good chance to look and see where the beds were and where the patients were. And really, truly, most of the patients were on that unit as well.
In preparing for this topic today, I reviewed the AMSN core curriculum, which is a fantastic read. And I was reviewing it and I thought, oh yeah, that makes sense. It's like all the things I learned and then you kind of have in the back of your head. And I think some things you do subconsciously and some things you're just like, oh, I forgot about those little tweaks we make to our assessment abilities, the way we approach the patient, the bariatric patient. They have different needs. They have different requirements, even things like vital signs, patient assessment, to determine the ability of your patient to provide the care that's appropriate.
Yeah, that is a great call out. One of the things, it was the best refresher for me when I was reviewing it was about how vital signs are going to look potentially fairly different. And I generally have a certain range in my head for all patients, and that's not a one size fits all for sure. It's not a cookie cutter.
Yeah. One thing that stuck out was the axillary temps. They're not accurate. And I thought, oh, I remember that 8 years ago, maybe 12 years ago when I read it somewhere. But you're right. So now maybe I really need to count respirations. Maybe it's not everyone's 16 or 18. Who knows?
Yeah. So a good point is just kind of refreshing ourselves in the potential health issues that can occur too in that patient population. When I was rereading the information, I am over the discharge unit for our healthcare facility too, and I make sure that we specialize our discharge instructions for all of the patient population. So that's important too, just thinking about all the specialized instructions and the specialized things that go with that patient population. So I was thinking about that today as I was rereading the information. So how do we ensure that we're promoting their dignity and treating them with the utmost of care and not making them feel any different?
It's funny you bring that up. It's like we spoke about how there's the stigma and the shame that's kind of associated with healthcare. I feel that there is shame that keeps bariatric patients away from the healthcare setting because they feel the judgment. And I've experienced it in patient care. I've had a bariatric patient, right, who I was assisting them. And then I go and I come back and their demeanor kind of changed and they're kind of like sad, a little depressed. And I'm like, what's going on? And so what had happened was the patient's in the room and someone came in to assist them. We call them CNAs. Some more team members came to assist and the team members were not laughing at the patient, but when they left the room, they were laughing, but not at the patient. You know what I mean? It was something that was, just in general, just because like one of those shifts where you're just picking up and helping, but the patient just assumed it was at them. And it's little things like that. So we had to explain it to the team and they came and they explained it to the patient and say, we're sorry it wasn't focused at you. It's just little things that we need to take into consideration.
Right. So, or going in the room maybe and saying, oh, I need to go get some help or I need to get an additional person or people. Just being very careful of how we phrase, maybe that kind of thing.
Right. It's even the little things like we have regular gowns, we have bariatric gowns. So you don't call out, because I've seen it, you don't call and say, I need the big gown. You know what I mean? Mm-hmm. It's little things to preserve their dignity and respect. It is specialized, but I mean, the curriculum said, 42% of the United States is considered obese. I mean, it's something we all need to be aware of. It's not as insignificant.
Yeah, I think we just need to be aware and challenge ourselves in our conversations and our responses. We had a similar conversation when we were talking about the substance abuse patient population in a way that we just needed to challenge our thinking and make sure that we weren't have any bias, but not only the bias, but just our responses and our conversation and our thinking. Honestly, it's not that different.
Absolutely. It's not that different. It's just a little more patient. It's the same things though. It's just a different way to approach it.
Mm-hmm.
I think that's why doing a thorough assessment, especially the functional assessments, are so important, because those patients are going to decompensate also when they get to the hospital, just like anyone else does. But if everyone's too afraid almost to get them out of bed, then they're doing them a disservice. And even if you do need those mobility devices, a walker or a Hoyer lift or whatever, just because they're of a larger weight doesn't mean that we can't get them out of bed, get them moving, and doing the things that they need to do to get better, just like we would with other patients. We had a bariatric patient that for a while we didn't get him out of bed because we just didn't think that he necessarily could, and we didn't have the tools or the staff to always be prepared to get him out of bed when he was ready to get out of bed, or physical therapy would come and then he wouldn't want to, and it just always seemed like the time was never right. Probably like a week into being there, his wife was there and he was just up walking around, went to the bathroom. I was like, wait, you're great on your feet. And his wife's like, yeah, what do you mean he's great on his feet? I'm like, this man has been in bed for 3 days. We can't have these assumptions about what they're able to do, just like you shouldn't with any other patient. But I think that that stigma, that unconscious bias can be there, especially these patients when it comes to their functionality.
Yeah. Based on your past experiences in the hospital with bariatric patients, what have you encountered and what are some of your experiences with them?
For me, experience that comes to my mind is when I had a bariatric patient, and knowing, you know what patients you're going to get before you get them. Your new admission, you know what type of admission you're going to get. You get report from the emergency room. And for me, I have to kind of make it where I use the team approach, and that has been helping me. So if I know I'm going to get a bariatric patient, as soon as I meet my patient, I will make sure my PCT is with me and another nurse. And so we approach the patient, hey, welcome to your room. This is the team. We have the PCT. We have me as your primary nurse, and we have a secondary nurse. And we all come in to just do an assessment. I have one nurse that's going to help me look at your skin. I have the other nurse that's going to help support. And we kind of approach it to where we do this as a team, no matter if you are a bariatric patient or not. We treat them just the same. And we just kind of use support. If we need physical therapy to come in, they'll come in, they'll assess, they'll help. And we'll just kind of use it maybe every 2 hours or so. I'll say, okay, the team is going to come back. If I need help in repositioning them, we have the team to support at all times. And so throughout the shift, I've been making that kind of a thing where if I have a bariatric patient, I don't have to waste time looking for somebody to help me or hit the call light for someone to help me do the things. We come in as a team so that they will feel like, this is just something common and normal that we do. So that's just a tip, always carrying a team with me to kind of help do those assessments and just make it feel like it's a normal thing that we do in the unit.
I think that's a great approach. Because you're so organized when the patient arrives, then that doesn't make the patient feel offset. Some of the times I was describing was from some times where we've gone in unprepared and then had to go back in and let me get someone else. And that's when it looks weird. I'm going to say it looks weird to the patient and makes them feel awkward and makes them feel like, oh gosh. Honestly, they might feel like they're having to get help because I'm heavy or I'm different or something. I'm just being honest with you. How about you guys? What other experiences?
I think it's definitely similar with equipment, making sure that as soon as we have it posted to the room, if you have the resources available at your organization, ordering the equipment as soon as we know that they are coming so that hopefully it's going to be up there before the patient gets there. That way we're not saying, oh, I got to transfer you to a bigger bed. It's something that's already available. It's part of their plan of care.
Yeah.
Absolutely.
And zero your meds.
And as the core curriculum said, daily weights, make sure that they're there, they're accurate and all that. Because the reason we try to target that one unit, which is like 32 beds or something, is because they are prepared for all that. They have the bariatric equipment in the rooms, as in walkers. Their commodes hold up to, I think it's 650 pounds. Their commodes on the walls themselves. and they're like a bariatric center of excellence. So they have the bedside commodes that are the bariatrics and the walkers and all the things. Of course, we can't always do that, but that's why we do that.
What do you guys think bariatric patients in general would like for Med-Surg nurses to know about them, what they go through, and how they hope to be treated?
I would think that they just wouldn't want to be judged, which is any patient. When you come to the hospital, you're at one of the most vulnerable times of your life, and you don't need to be feeling self-conscious during that.
Yeah, I agree. I mean, it's almost a very general question because I think it's what everyone wants. Everyone wants dignity, right? Everyone wants respect. You're absolutely right. You're 100% vulnerable. There's going to be situations where you're going to be undressed, in states of undress, getting cleaned up. And it's just remembering that it could be you. How would you want to be treated? And I think compassion and respect.
Yeah.
Speaking to some of the bariatric patients, one guy, he just really wanted us as nurses, as staffs, to understand that for him, he was taking some new seizure medications, and he was once a smaller size than he currently was. But due to him taking those seizure medications, he began to gain weight. He was not able to control it. He would diet and he would do all the things, but he just kept getting larger and larger. And so when he would be admitted to the hospital, the one thing he said was, I wish the staff would stop thinking I'm lazy and stop thinking that I'm non-compliant. It was because of the medications. And so just kind of talking to him, realizing that his story was different than others, just everyone thinking of that. Everyone is not the same. They're not just non-compliant. They're not just sitting around binge eating. It can be the medicines that they're taking. It can be the maybe hormone replacements or chronic conditions that are making them obese like that. So just be mindful.
I agree. I just wanted to remind everyone that the AMSN core curriculum is a fantastic book to review. Not just for this topic, but for so many others. I think it's an incredible read. I think it's an incredible piece of reference that we should all have. Let's go around and have each of you share your biggest takeaway from this conversation. Trish, what are your takeaways?
I am reminded that our words and our perceptions of people, we need to be very intentional with.
Kellye, how about you?
I would say a biggest takeaway is just being aware of how we are talking to our bariatric patients, and that everyone has a different way of how they became who they are. So just being sensitive and being mindful of how we're speaking, speak more kinder, speak more gentle, and just get help as needed, but be confident while you're caring for your bariatric patients.
Sydney, what stood out most for you?
There's different reasons how people come to be the way they are. Most people aren't choosing to live an unhealthy lifestyle. They don't want to be doing things that aren't good for them. It can be a medication they're taking, a disease process that they're going through, a mental health crisis. There's so many reasons why people end up in the situations that they're in. And so similar to what she said, just practicing compassion, checking our biases, and treating our patients with what they need. And that's what nurses should do with every patient.
Haley, what did you take away from this conversation?
I feel like every episode I learned something from Kellye, because I think it was a great strategy about setting the precedent from the beginning that we have a team, and that team is going to go in and we're going to help care for you every time that we're in there, so that it's not an awkward, embarrassing moment where we're calling in all the ancillary to help turn them when you need them in that moment. So thank you for that tidbit.
Yeah, thanks, Kellye.
No problem.
As for me, you're right, Haley and Sydney. I'm going to go up there with Kellye because she said it right at the end. It's right. It's about speaking mindfully and watching your words and remembering you don't know someone's struggle. You don't know what brought them to us. You just know they're there. And that's what we treat. So for our listeners, we'll include a link to the AMSN core curriculum in the show notes for this episode. And as always, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurg Moments on your social post.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Sydney.
Eric?
Trish.
Kellye.
Haley.
And Marcela. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.